Fluoride by Miriam Owens. What is fluoride? According to Oregon State University's Micronutrient Information Center, fluoride is the ionic form of the naturally occurring fluorine element. The anion increases the structural stability of teeth and bones through interactions with calcium phosphates. You can find fluoride in most dental products, such as toothpaste and mouthwash. Fluoride can also be found in community drinking water. So how much fluoride is recommended? Well, fluoride occurs naturally in our environment, but we consume it in small amounts. The amount of fluoride needed is so small, they call it a trace mineral, because it isn't needed for the body to grow. The table to the right shows the dietary reference intakes and upper limit of fluoride. Now, fluoride doesn't really have a dietary reference intake. More, it has an AI, or adequate intake. These are based on the prevention of dental caries in the specific life stages. Male and females are fairly similar up until the ages of 19, where males increases by 1 more milligram per day. Now, the upper limits are provided to prevent the development of skeletal fluorosis. So when you think about fluoride, what comes to mind? What comes to mind for me is seeing my little 5-year-old daughter sitting in a giant dentist chair with a big tray in her mouth, and her mouth is so frothy and bubbly. Now, it almost kind of looks like she's a rabid dog, but really it's just the fluoride. But what else comes to mind is obviously toothpaste, and now water. Fluoride has been recognized to be vital to dental health. It helps with the remineralization of tooth enamel. This encourages the strengthening of the enamel and supporting the prevention of dental caries. The picture to the right kind of shows you what I mean. Fluoride ions replace hydroxide ions inside teeth and bones. Small amounts of fluoride strengthens teeth and bones, while too much fluoride causes teeth and bones to be too dense and brittle. Fluoride helps in the remineralization of the tooth enamel. Now, it's constantly being exposed to demineralization processes. So it's important to have the appropriate amount of ions present in the saliva to help inhibit these processes, which can be carried through different mechanisms such as brushing your teeth, mouthwash, even drinking water. Now, many of the foods we eat contain small amounts of fluoride. Fluoride is found in the water, such as oceans and rivers, where many shellfish and fish pick up the element. The table to the left actually contains a list of foods and the concentration of fluoride which they hold. Now, what surprised me was like black tea. But if you think about it, these plants are being watered, and of course that water must have fluoride in it, even if it is in small amounts. So the leaves are absorbing that fluoride from that water. While, as we know, shellfish products, they live in water, and so on and so forth. Kind of amazed me at the different types of foods that I eat and the concentrations of fluoride in each of them. Now, as stated before, most of the water has a naturally occurring fluoride content. This is not in substantial enough quantities to decrease the risk of dental caries. So many cities have added the right amount of fluoride into the water system to increase intake. Since the addition of fluoride to drinking water, the U.S. has decreased the occurrence of cavities in children and adults by about 25%. Now, the graph next to the right actually shows the different types of countries and the average decayed, missing, or filled teeth at age 12. And as you can see, since 1975, it has decreased substantially on how many dental caries there are. Yes, you can have fluoride deficiencies. The only clear effect, though, for inadequate fluoride intake is an increased risk of dental caries, or tooth decay, for individuals of all ages. With this in mind, maintaining just the right amount of fluoride will help in preventing tooth decay. Pictures to the right shows different stages of tooth decay, from healthy teeth to severe tooth decay. And fluoride, like many other things, can be toxic when consumed in excessive amounts. So, concentrated fluoride products should be used and stored with caution to prevent the possibility of acute fluoride poisoning. Now, I got this information from the Micronutrient Information Center on Oregon State University's website, and they state that the lowest dose that could trigger adverse symptoms is considered to be 5 milligrams per kilogram of body weight, with the lowest potentially fatal dose considered 15 milligrams per kilogram of body weight. And with that, the side effects could be nausea, abdominal pain, vomiting, which they say almost always accompanies acute fluoride toxicity. Other symptoms like diarrhea, excessive salivation, and tearing, sweating, and generalized weakness may also occur. So, consuming less is better. Now, the nutrient function of fluoride is really just there to keep your teeth from getting dental caries. There really isn't any metabolism besides keeping it from decaying. In high amounts, fluoride is toxic and can cause fluorosis in the bones and enamel. Now, skeletal fluorosis is characterized by calcifications on the bones, which cause joints to become stiff and rigid. And on the teeth, the enamel becomes stained and pitted. Just like many things in life, fluoride must be utilized with discretion and moderation. The picture shows different stages of fluorosis on teeth enamel. Some interesting facts. Honestly speaking, I knew a bit about fluoride from various science classes and its effects on our enamel. One thing I didn't know was the cause of excess fluoride intake. Knowing now that I personally have mild fluorosis is kind of worrying, but I feel can be taken care of by limiting my access to fluoride. In saying that, another interesting fact I found about fluoride is the inhibiting effect of calcium and magnesium on fluoride absorption. So, when put together in the same mill, this can cause an inhibiting effect. Well, on the internet, I found this picture of two men carrying a big container of fluoride over the water main. And it says, "Watch out, Tommy, don't spill it or we'll both be goners." Which, their fact is, fluoride is so toxic that it is considered hazardous waste by the EPA. Now, fluoride, like other things, is toxic in vast amounts. This can take place when a child decides to eat a whole tube of toothpaste, or two. Now, in these situations, fluoride is considered dangerous, as it possesses a risk to skeletal bones and enamel by calcification of ligaments. Well, and just bones on that one. Though, for the most part, fluoride is considered safe in the appropriate dosage. With better knowledge on the adverse effects of fluoride and paying attention to intake, we can decrease instances of overdose. In conclusion, while preparing this presentation, I learned that despite something genuinely being good for you, it can pose risks. I never knew that fluoride was the reason for the white spots on my teeth, or that it could cause skeletal issues. With all the information I digested during this process, I have gained the knowledge to better arm myself against these certain dangers. Fluoride can help in fighting off dental caries, which can keep our mouths healthy, With healthy mouths, we can consume food to sustain our lives, which is important if you want to remain strong. Much like everything in our lives, the key is moderation. Thank you.